the title of the story in the New York Times was Insurers Reap Hidden Fees by Slashing Payments. You may get the bill. That's the title of the article. And when I saw the title of the article, I said, you know what's interesting? That article says something that everybody kind of knows, everybody kind of feel, but it should have been different. It should have been yet another insurance scam that leaves the bill ultimately with you. Do something about it, people. Raise hell about it. Yeah, long title. But that's what the title should have been. And I'm going to start the article with a simple, with the way they started. It says, weeks after undergoing heart surgery, Gail Lawson found herself back in an operating room. Her incision wasn't healing and infection was spreading. At a hospital in Ridgewood, New Jersey, Dr. Sidney Rabinowitz performed a complex hours-long procedure to repair tissue and close the wound. While recuperating, Miss Lawson phoned the doctor's office in a panic. He returned the call himself and squeezed her in for an appointment the next day. He was just so good with me, so patient, so kind, she said. But the doctor was not in her insurance plan's network of providers, leaving his bill open to negotiations by her insurer. Once back on her feet, Miss Lawson received a letter from the insurer, United Healthcare, advising that Dr. Rabinowitz would be paid $5,449.27, a small fraction of what he had billed the insurance company. That left Miss Lawson, hear this now, hear this. This is how we talk about transfer of wealth from all of us to the few. After the insurance company and the employer and the doctor did all their magic, this woman who pays for insurance, she was left with a bill of $100,000. I'm thinking to myself, but this is why I had insurance, said Miss Lawson, who was fighting United Healthcare over the balance. They take out, $300-$400 a month. Well, why aren't you paying these bills? The answer is a little-known data analytics firm called MultiPlan. Let me stop from the article and explain a few things with you right now. There are companies that just pop up, right? You may have been working in the office at a doctor's office and say, hey, man, there's a way that we can actually create a business model that we can save the insurer money, we can save the employer money, and we can stiff the doctor. And after we stiff the doctor or the hospital or whatever, the person who ultimately gets held on to the bill is the patient. Remember, ultimately, the patient always ends up with the bill. You go to a hospital, you're sick, you're hurt, and you're in pain. You want a cure, you want something done. And then as you're in the emergency room, and this just happened with my wife, as remember she had what we thought was a stroke, but it was a palsy from shingles, and she was very, very sick since she got shingles with lupus. And, you know, as I went through the process, I am seething because I'm seeing good doctors, good nurses, and everything else. But who comes into the room as her head's banging, as she's in pain? And this happens to everybody who goes to an emergency room, who goes to a hospital, etc. Here comes the business office. She can barely see, she can barely talk from the pain, and they're asking, who's your insurer? How much is XYZ? What's your plan? And there's a whole litany of questions on how this bill that is yet gonna be that is yet being given, how it's gonna be paid, and then you're asked to sign a thing that says, well, by the way, if the insurance doesn't pay the bill that we are going to charge you here at the hospital, you're signing away ultimately that you will pay. In other words, you're extorted at that point, right? You are not going to not sign something when you are there with a stroke when you're there with a pain or whatever, you're going to sign that bill. I mean, you're going to sign that promise that says, no matter what the hell you guys charge and what the hell the insurance doesn't pay, I'm going to pay it. Hell, my head hurts. My body hurts. I need your care. You sign it. You sign it. So this company, the answer is a little known data analytics company now called MultiPlan. Notice what they call themselves, a data analytics company. They have nothing to do with healthcare. They know nothing about your condition. All they do is look at the numbers. So let me continue with the article now. It works with United Healthcare. They work with United Healthcare, Cigna, Aetna, and other big insurers to decide how much so-called out-of-network medical providers should be paid. It promises to help contain medical costs using fair and independent analysis. But a New York Times investigation based on interviews and confidential documents show that MultiPlan, another parasite, and the insurance companies have a large and mostly hidden financial incentive to cut those reimbursements as much as possible, even if it means saddling patients with large bills. The formula for MultiPlan and insurance companies is simple. The smaller the reimbursement, I repeat, the smaller the reimbursement, the larger their fee. In other words, they make more money by telling the employer and insurer to pay less to the provider, meaning the hospital or doctor. And since you have already signed away your life with the hospital or the doctor, when that insurer pays less to the doctor or the hospital, guess who promised to pay that bill? You did. Because before any one of these people give you any service, they make you sign a statement that says, if the insurance doesn't pay, you will pay. And MultiPlan, the parasite in the middle, says, hey guys, I'm going to show you how you don't have to pay the doctor, and I'm going to show you how you don't have to pay the hospital. And by the way, the amount that I save you, right? I am going to make a percentage of the amount of money that I save you. So what's your incentive as MultiPlan, that parasitic company? You try like hell to not pay the hospital or the doctor, irrespective of whether it's justified or not, because you make a percentage of the saving. You don't make a fee that says, I'm going to hire this company to take your business from you. You make a percentage of the fee. And why do employers like that? Because, employers usually are the ones who pay the bill, and the insurance companies just administer it for the employer. So the employer wants to reduce the cost, and they are willing to just say, okay, I'll give you a percentage of what's saved. If it were a real business, it would say, my service to you is to look over the records to make sure you're not being overcharged. But no, they make a percentage of what they save you. That's what called legal fraud. That's what called parasitic behavior. They provide no real services, right? But a New York investigation based on interviews and confidential documents show that MultiPlan and insurance companies have a large and mostly hidden financial incentive to cut those reimbursements as much as possible, even if it means saddling patients with large bills. The formula for MultiPlan and the insurance companies is simple. The smaller the reimbursement, the larger their fee. Remember, it's a percentage. Here's how it works. The most common way Americans get health coverage is through employers that self-fund, meaning the employer pays for their workers' medical care with their own money. The employer collects a fee from every single employee. Like we may pay, let's say, $1,000 a month for health insurance, and the insurer may have, let's say 10,000 employees. So they are collecting $10 million a month from all the employees. And then they pay an insurance company to administer insurance for, whenever bills come up, etc., with the doctors, the hospitals, etc. Instead of them hiring an insurance company and paying an insurance company fee, the employer takes on the risk of collecting the money, holding the money, and then they pay a small fee to the insurance companies just to administer insurance that they are funding. Another ridiculous setup, but that's what it works. That's how it works with a lot of big employers. All right. The employers contract with insurance companies to administer the plans and process claims. Most medical visits are with providers in a plan's network with rates that are set in advance. All right. So the employer and these providers usually have rates, but there are times that you get out of network service. And let me tell you how that can happen. No fault of the person that's there. You go into a hospital and you have a problem. Like, as an example, my wife went into the hospital. She has lupus and she got meningitis. She went to the hospital in her plan, in the district's plan. She went to that hospital. So that's taken care of. Bingo. But within that hospital, there are doctors. And not every single doctor that's going to see you, because a doctor may be off or whatever, they may see you. So she had to see while in the hospital, she saw a neurologist, she saw a nephrologist, she saw a general practitioner. She saw what's the doctor that takes care of lupus? The one who takes care of things like arthritis and so forth. She saw one of those doctors. Now, they were all very nice. They stuck their heads in there for about no more. Maximum was the longest doctor spent about 15 minutes in there. And that is only one day they spent that time. Normally they come in with their phone. With the first time that one of them came in with the phone, they looked at the phone and they had her name, rheumatologist. Thank you, Alistair. They look at their phone and it was they had the wrong patient. And then I said, no, that's not her. And by the way, that's why you need an advocate in the hospital. I'm like, that's not her. It's she is. And then he said, oh, yeah, your test came back XYZ. And he started telling her these things. And he never touched her. He never used his stethoscope, even though it was around his neck, to check her heart rate, anything. So most of them came in, said a few words, and left. Okay. Some of them, before they left, I queried them and made sure that they answered a few questions. And, so the way most of them dealt with her was to look at they take blood every day, look at the results of blood work, etc., ask her a few questions and walk out of there. 5 minutes, if that much, right? And my wife would say things like, they were so nice. Yeah, I'm like, yeah, but that's cha-ching. Every doctor that opened that door looked at you, that was cha-ching, meaning, $400, $500, $600 that would be charged as soon as they saw you. And, I'm sitting down there with a little smile on my face and what a healthcare system. What a healthcare system. So now the thing is, some of those doctors will be taken care of immediately. A lot of times those doctors are not even sure if the person that they're seeing in that hospital happens to be on the network that they are in. So, they come and they do their job and they see the patient, and then they go ahead and they issue the bill, and maybe they're in the network, maybe they're not. But if they're not in the network, right, and the insurance company pays them a piece of that bill, they're then coming to you for paying that rest of that bill, which is what happened to this woman here, who they paid the doctor $5,000, which would have been a contracted rate maybe for somebody in the plan. And then that doctor, the difference was his bill was really $105,000. I don't know why it was that high, but it was $105,000. And then the patient got stuck with $100,000. $100,000. And that doctor has the choice then of coming to that patient with the bill. And then after coming to that patient with the bill, if that patient doesn't pay, from a legal standpoint, they may not do it, but they could. That doctor's coming after that person's house, that person's car. They are going to bankrupt them. That is what happens most bankruptcies in the United States. The doctors, the hospitals, they all come after you for non-payment, and then you're responsible. Look, right now as it is, a few months ago, my wife had a biopsy. Some of you have heard this already. And, the bill came in the mail, and she passed it on to me, and she says, check this out. And I looked at it, and it was so large, I could do nothing but smile. Actually, I laughed. A biopsy, she was in that hospital for 1 minute. For 4 hours. We got there at 8 o'clock. We left there at noon. They did a needle biopsy. They sat her in a room, in that emergency room for those hours to make sure she wasn't going to bleed out. And we left. The bill came. It was $27,000. $27,000. And the insurance company, then the hospital sent another bill saying, of that $27,000 insurance company paid most, you're responsible for $3,000. I told my wife we're not paying that $3,000. I am going to make a national issue out of this entire case. I am going to blog it. We haven't resolved it yet, but if it's not resolved, I am going to blog, write, and take it everywhere else. And, we know there are more bills coming because, again, she was in the hospital twice since then because of shingles/lupus complications. But there are these companies now, they provide no service. They provide no health care. They simply look at numbers, pieces of paper, and they tell an insurance, don't pay this bill. They tell an employer, don't pay this bill. And because they tell the employer not to pay a bill, and the employer does not pay the bill, they then get a big chunk of money from a percentage of that bill from the employer and from the insurer. But it goes deeper than that. It is so bad that this company, MultiPlan, several times make more money from that non-payment than the provider itself, meaning than the hospital gets from the insurer or than the doctor gets from the insurer. If you can't tell me there is something wrong with our healthcare system, and for all of you who are indoctrinated and so scared when we talk about a single payer system and getting the private insurance companies out of the market and getting employers out of insurance. Oh, because somehow you think your freedom is going away. I'm telling you. And most people are not sick at one time, but at some time you will get sick. And when you get sick, the vultures are coming. And you may think you have great insurance until one hospital, until one doctor somehow gets around the plan that you have and gets you stuck with the bill. Because remember, all these guys have pricing power and they want to be paid. And the only victim, the only one without pricing power, the only one that can be taken advantage of ultimately is you.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.